Myocardial infarction is a medical emergency which requires immediate coronary intervention, and as such rapid assessment of the patient. An ECG is a key diagnostic test for myocardial infarction. Let's first review classical ECG changes in ST elevated myocardial infarction or STEMI. The first ECG finding in acute myocardial infarction is hyperacute T waves, which are tall and symmetrical and occur within the first few minutes. The hyperacute T waves then resolve, and ST elevation develops in affected leads over minutes to hours, with ST depression in reciprocal leads. The ST elevation associated with myocardial infarction tends to be convex, and may become elevated above the T wave, causing tombstoning. This is what tombstoning looks like. As ST elevation improves, pathologic Q waves and T wave inversion develop. Pathologic Q waves may persist for life. The presence of left bundle branch block, or LBBB, makes interpretation of an ECG for STEMI impossible. However, new-onset LBBB is considered a feature of ST elevation myocardial infarction. How may myocardial infarction be missed on a 12-lead ECG? 1. Myocardial infarction may be missed on a 12-lead ECG if the ECG is taken early after the onset of chest pain. This is why serial or repeat ECGs are often essential in the diagnosis of myocardial infarction. 2. Myocardial infarction may also be missed if the infarction is located in an area that is not well represented by the leads of the 12-lead ECG, for example, inferior and right ventricular infarction, as well as posterior infarction. 3. Non-ST elevation myocardial infarction or NSTEMI may present with many features of STEMI without ST elevation. NSTEMI is an acute ischemic event causing irreversible necrosis of heart muscle. The initial ECG may show ischemic changes such as ST depressions, T wave inversions, or transient ST elevations. However, it may also be normal or show non-specific changes. 4. Needless to say, myocardial infarction may also be missed on a 12-lead ECG if the ECG is of poor quality. 5. Myocardial infarction may also be missed if the patient has a pre-existing bundle branch block which makes the ECG interpretation harder. 6. Myocardial infarction may also be missed if the patient has a pacemaker, as they can cause a variety of ECG changes that can make it difficult to diagnose myocardial infarction. Remember that a diagnosis of myocardial infarction should not rest solely on an ECG. A careful history coupled with blood tests such as cardiac enzymes and troponin T are also important. Chest X-ray and echocardiogram may also aid in the diagnosis. Repeat ECGs may also be necessary if there is an index of suspicion. We hope you found this little review helpful. If you do, please like, share and subscribe to our channel.